Thank you, Mr. Chairman, and Ranking Member Scalise. Appreciate the hearing today. Obviously, this is a tragedy that's going on. It's we find that as a result of a lot of the studies that are being done over the last several months, that this is a very targeted disease. Where it's targeting individuals who have high-risk health conditions and our seniors, and many of them are in nursing homes. And obviously, when you congregate them all in one area, they're all high risk. We wind up with the problems that we have today. It's very discomforting to me that I in our briefing notes here we look at I think I counted 7 different guidance directives from CMS with regards to how nursing homes could help themselves and their residents with regards to how they could do something for corralling the coronavirus in their own facility. And so it seems to me like if there's more guidance that's needed, that's fine. But I think at some point somebody needs to take advantage of that guidance and actually do it. Mr. Kirkman, you gave a lot of very interesting and informative information. I certainly appreciate that. 55% of the deaths now are from nursing homes. That's phenomenal. Wow, that's off the charts. Kids are less risk for the flu, for the COVID and the regular flu. That's an interesting number. And over 60% of deaths are for people over age 75. So it is a very targeted disease, and I thank you for that information. And one of the things that we've learned, that I think going forward, is because this is a very targeted disease, I think that we should be able, whether not or not, but we should be able to target the disease, especially if it's confined to nursing homes or to seniors or to folks in a high-risk health condition, to be able to attack those and maintain and manage those in a way that can minimize their risk, as well as then open up the rest of society who has a less risk, as you just said, with the kids actually having less risk than the regular flu. So, Mr. Kirkman, would you agree with that statement that we probably are at less risk with the rest of society, can open up pretty well?
Yeah, I think that's correct.
What would you say we need to do to manage better the nursing homes, the risk that's there? Since I know there's been a number of folks give a lot of different ideas, but I'm curious about your ideas with regards to how we would better manage this from the standpoint of if that's where our problem's at, that's where we need our focus on.
Yeah, well, I think it starts with having the focus and the prioritization matched with where the risk is, which is to say we should not have national messaging that says everyone's at risk. This is the message needs to be really about who's truly at risk, and that's what the focus needs to be. And it's fine for the administration to put out a whole bunch of guidance documents and to say these things and to say, in documents somewhere that this is who's at risk, but it needs to be the major national focus, sustained, explained, so that people get it, so they understand who's at low risk and who's at high risk. I think that national tone-setting messaging is critical. In terms of policy implementation, I think that there are generally adequate resources if the states prioritize them correctly, which is how some states have done a much better job. You don't need to be mass testing the general public and everyone who wants to do a walk-up testing, even if they have no symptoms. If you could be using those same tests inside the nursing homes and other high-risk populations, but especially inside the nursing homes. And several European countries now have stopped broad population testing completely and put all their testing resources into the nursing homes, and it may make sense for our states to shift in that direction. So I think the resources that we already have could be much better utilized in terms of directing them to where the risk really is. But also, in terms of some of these big government programs, some of the things that are being suggested, putting more money into this, more resources, paid sick leave, that kind of thing, these are all things that as a conservative I would normally oppose. But if the bargain is we put these resources into nursing homes in exchange for opening up the low-risk activities and accurately communicating to people that they're not at risk, that might be worth considering, because the costs of these sort of blunderbuss broad lockdowns are so enormous and so incommensurate with risk that whatever we can do to address what's truly high risk, I think is going to be worthwhile if we can also open things up for the low risk.
Yeah, we had a study that we were talking about, I think, last meeting with regards to the lockdown and shutdown costs about 65,000 lives a month on for the rest of society, and we're losing much less than that on the COVID side of the balance sheet, which I don't think this is a ball game we should be keeping score here. But by the same token, you have to focus where your problem is, and we're having more and more people die on that other side. It certainly is significant needs to be taken a look at. I think one of the interesting things I'm curious as to when you lock down the nursing homes, and Miss Lally, I certainly empathize with your situation. My mother was in a nursing home for 7 years, and I know that while she did get good care, that there are nursing homes that don't give good care, and it's very disconcerting. But I'll just kind of get you a quick question with regards to, you made the comment that she became less, you started to see her condition deteriorate once she was able to visit with other people. I think that's a question I would be curious to see once, if you had that as a if you saw that as a problem, or she's being able to interact. Did that cause some of her problems, you think?
What, not being able to interact with others in the nursing home specifically?
Well, even her family members.
Undeniably, the isolation and the loneliness was definitely a part of it. But I genuinely believe that inside the nursing home where my mother resided, they were struggling with proper staffing. I believe that there were periods of time where my mother didn't see anyone probably all day except for a food tray to be delivered, if that occurred. I really believe that her quality of care and the continuity of care was compromised very early. Combine that with loneliness, isolation, and having visits outside of a very dark screen on a window with kids covered in masks, it made for just a horrible situation.
Thank you very much. The chair now recognizes Ms. Velasquez for 5 minutes.